Hello, professionals. My name is Donna Edwards, and I'm going to provide you with some continuing education units so that you can continue to work in your profession with some enhanced knowledge. I am a certified addiction treatments counselor number 4 who is accredited by the Addiction Counselor Certification Board of California. I have worked in this profession for over 20 years. I am a CEU provider approved by CADIE, California Addiction and Drug Educators. So I'm going to get into a discussion with you in treating co-occurring disorders. This is an introduction to treatment goals and themes. So let's look at some treatment goals. They're establishing goals in the initial and most critical phase. Goals give direction. Effectiveness of goals can be measured. Outcomes can be evaluated and helped the reassessment phase. Two main targets is abstinence and psychiatric intervention. Treatment themes. Regardless of treatment's modality, 10 themes have been presented with co-occurring disorders. Acceptance of mental disorder. Acceptance of the impact of substance use. Identifying what is normal. Differentiating between medication and drug use, dealing with negative client, family, or community response to the symptoms of mental disorder, dealing with the victim's role, dealing with relapse and the return to psychiatric symptoms, dealing with suicidal ideation, dealing with achieving more stability, dealing with mental illness and self-help meetings. Treatment themes. Acceptance of mental disorder. Not one wants to have a mental disorder. Accepting the existence of a mental illness often means that an individual must change many life expectations. Having a mental illness usually involves limitations. Acceptance of the impact of substance use. People with mental illness want to use alcohol and drugs like the rest of the population without mental illness. The alcohol and drug reduces some of the mental illness symptoms and makes them feel more comfortable in social settings. Alcohol and drugs ultimately make the mental illness symptoms worse. Treatment themes. Identifying what is normal. Individuals with mental disorders, especially those that cause serious impairment, often cannot differentiate normal moods or thoughts from those caused by their disorders. Differentiating between medication and drug use. Clients often view the use of the psychiatric drugs as dependence on other drugs, including the substances of their choice. Dealing with negative client, family, or community response to the symptoms of mental disorder. Often family members and the community view individuals with mental illness through the lens of stigma, lazy, unmotivated, personally responsible for their conditions. And in fact, many clients accept this view of themselves. Dealing with the victim's role. Clients often see themselves as victims of their condition and believe that they have little mastery over their life. Dealing with relapse and return of psychiatric disorder. Relapse and intensification of psychiatric symptoms bring a range of emotional to the clients. There's guilt, shame, sense of failure, fear of no change, loss of hope, and keep hope alive. Dealing with suicidal ideation. Some individuals with MHD struggle with suicidal ideations on a daily basis. Dealing with achieving more stability. Clients who have DUS and MHD for a long time and going in and out of treatment facilities might find themselves ill-equipped in many aspects of their social, professional, and family life. The idea of functioning in a healthy way might be overwhelming and a trigger by itself. Dealing with mental illness and at self-help meetings. The self-help meetings, such as AA or NA, are not made to do help MHD. Individuals with co-occurring DICs usually struggle to participate in these meetings. I want to thank you for watching this video. Next, you'll be taking a quiz. Once you pass, you'll receive a certificate of completion with your CEUs that you have earned. My valid provider number will be on your certificate to turn in to your certifying body.